Hi, everyone. I'm doing my presentation on dementia and memory recall treatment. I chose this topic because my grandfather has dementia and he has significant difficulties with memory recall. So, first, I started off with what is dementia? It is a group of symptoms rather than just one specific disease that affects memory, thinking, cognitive processing, and social abilities um, severely enough to interfere with daily functioning. I think that's important. People's quality of life greatly goes down when their daily functioning is impaired. So that is a big thing in dementia. It's a cognitive deficit, and it is more common in older individuals, which I think most of us probably already knew. Some criteria of dementia that shows what is impaired: memory, language skills, visual perception, the ability to pay attention, focus, emotional control. There are problems with personality changes, solving problems, reasoning, and I think a lot of this um, is affected, comes to light because of memory and language skills being gone and reasoning. And just once again, I want to stress the fact that dementia causes an individual to struggle or to have difficulty to do a routine everyday task. These are some symptoms of dementia. It affects memory. They have difficulty with memory recall, short and long term, apraxia, agnosia, anomia, aphasia, all things we've talked about. And then it impairs cognitive functioning, difficulty with social interactions, difficulty following a routine. And these are all deficits that affect everyday functioning for these individuals. So it might be difficult to live alone or, to complete a task that before would have been easy to do. I'm not going to spend a lot of time here, but it's just important to know, because I didn't know this information, but there are different types of dementia. Alzheimer's is the most common, and that was the one I had known of. And I thought it was a different category than dementia, but it is a type and the most common. There's mixed dementia, alcohol-induced dementia, and vascular dementia. This isn't all of them, just some that I came upon. And it's important to remember that where the losses are in the brain affects the severity, the type of dementia that'll be present. The focus behavior that I'm looking at is memory, and that's I gave a simple definition to kind of break it down, the power or process of remembering what has been learned. And memory loss is common in dementia and other diseases that cause damage to the brain, as we already knew. The therapy that I focused on was spaced retrieval therapy. Space retrieval therapy is used for individuals with memory loss, not just individuals with dementia. It helps to improve memory recall, and it focuses on improving long-term memory ability. So how space retrieval therapy works is a therapist will give a question and then give the correct answer. And the goal is to get the individual to be able to provide that correct answer with waiting longer. So you give the question, they give the answer, then you move on, and then you build up the time in between so that they can improve their memory. The first study I did had 13 participants. The individuals were older. They received the space retrieval therapy training once a week, and the information that they were working on remembering was personally relevant information, which I think is so important because to me that information would be easier to remember. Of the 13 participants, 12 could successfully recall the information taught, which shows that the treatment was very effective. The study did give a piece of information that I thought was really important as a therapist to know, that individuals in the earlier stages of dementia might respond to treatment better and faster than individual with more advanced dementia. And I think, that is very important to consider with individuals who have dementia. My second study had 10 participants, 5 had Alzheimer's, and 5 had dementia due to alcohol. The different types and severity of dementia were reported. This study compared 2 types of therapy: spaced retrieval, which is what we talked about, and uniformed retrieval. There was no time in between for the uniform retrieval. It was the same for everything, same time periods between everything. And the information that they were looking to remember were pill names, which I found incredibly difficult and interesting, because I can't even remember my pill names that I've been taking for years. And they're long and they're complex, but for the sake of this study, they did shorten the pill names to be more concise. The results were positive. They showed that most individuals learned with the spaced retrieval training, and no participants learned with the uniform retrieval training. Spaced retrieval therapy helps long-term memories for individuals in Alzheimer's and individuals with alcohol-induced dementia, according to the study, which I think is important because it gives research not just behind Alzheimer's, but it also helps with other dementia and memory loss, which is important to know. The third and final study that I looked at had 4 individuals with probable Alzheimer's disease. They attended an adult daycare, and they used everyday objects to remember. So like jewelry would be a bracelet or an earring. They received the therapy in 9 sessions for an hour within 3 weeks, which seems super intense and quick and not a lot of time. And the results showed that all of the participants had showed few errors, and the longer time between trials they were able to remember, which is the whole point of it. And they did note that spaced retrieval can be enhanced by extending training sessions, which I think was just very important for this study, because 9 one-hour sessions is just not a lot for individuals with memory loss, in my opinion. And understand they had to have it, a time period, but that just seems really short. And 1 hour seems like a really long session if it's something you really struggle with. And this study, again, did state that there was little evidence collected to show long-term effectiveness of spaced retrieval training, even though the results were positive. I know they did compare this to an individual who already had training, and they just stated that little evidence was collected, but it shows insight and long-term benefits. Some final things to consider was that all the research articles I found had small sample sizes, which I think is interesting. I wasn't sure why, but I think it would be important for our field and for this therapy to have larger sample sizes in the research. The results were positive, and it seemed to be effective for individuals with different types of dementia and severity. And it's important to realize that we want to focus on the quality of life, and this type of therapy helps individuals remember life schedules, recall simple vocabulary for conversations and information, and so this would benefit an individual who has memory loss problems. But it's also important to consider that depending on the advanced stage of dementia for the individual, it's going to affect the effectiveness. So if an individual with very severe dementia might need longer sessions, longer time to remember one thing, where somebody who doesn't have as severe dementia could probably do it and remember things in shorter times, or learn to recall things in shorter times. And another thing I just want to stress is that you need to remember that the memories can't be rebuilt. We're just giving them strategies to compensate for the loss. And that is my presentation.